Hello and welcome to my channel again. So I'm here with yet another scenario. Now you can read that there is a woman who is 37-year-old presented to us with 6 months history of difficulty in swallowing solids which appeared gradually. Now this is very important that swallowing difficulty has appeared gradually over few months. She has tight skin over her hands and her hands go pale in winter. Now moving on to the next slide. Now what do you see in this picture? I can see these pictures. There are various findings that you need to pick up whether it's a PACES station or it's an MRCP2 exam, or even if it's MRCP1 you need to pick up the finding, or in any other clinical exam. What do you see in this picture? Now once you are examining a patient of this type, this patient has systemic sclerosis. Now examiner can ask you what are the findings in these pictures. Now you can point out few findings in this picture, like if you see there is puckering of mouth, the nose is a bit beaked, there is difficulty in opening mouth which is called as microstomia, and if you see the skin appearance, it is different in different places. So there is that is called as different pigmentation is called as diffuse, or different pigmentation is called as poikiloderma. These are the few things that you see in the face of a scleroderma patient, and they have a typical look. The next question they can ask you, that you'll have to examine the patient for whether the patient has CREST, which stands for calcinosis, Raynaud, esophageal dysmotility, sclerodactyly, and telangiectasia. If you see any telangiectasia, which are some narrow or new blood vessels, which you have to be careful, you should examine carefully to look for that in a patient. Obviously in picture they are different, difficult to see. Whereas how do you differentiate a crest variety from diffuse variety? In the crest variety of systemic sclerosis, you just have pigmentation of face and the distal extremities, which means below the elbow joint there will be involvement of the skin. You can see calcinosis. Raynaud phenomenon is obviously, which is change in the color of nails during winter. Esophageal dysmotility means he or she, the patient, will tell you about difficulty in swallowing food. And sclerodactyly we'll see in the X-ray, that will explain. And telangiectasia again means new vessels. Whereas in the diffuse variety, once you are examining a patient, you need to look at his trunks. You need to look at his trunk as well as uh, the above elbow area for any thickening of the skin, for any pigmentation, for any calcinosis above the elbow joint. Similarly, above the knee joints, you will have to look for the involvement. If there is involvement above the elbows or of the trunk, then this is not a crest variety, then this is diffuse. More common one is this crest variety of systemic sclerosis. Thirdly, you need to differentiate systemic sclerosis from mixed connective tissue disorder. A mixed connective tissue disorder will always have feature of systemic sclerosis, or patient can have serositis, patient can have features of rheumatoid or systemic lupus erythematosus. So mixed connective tissue is basically a combination of two or more diseases, and once while you're examining a patient of systemic sclerosis, you need to carefully look at the mucosa of the patient, plus any alopecia, if and a rash also. So if you see that, then you can think of mixed connective tissue disorder, which is diagnosed by doing anti-U1-RNP antibody, whereas CREST is is diagnosed by anti-centromere antibodies, and diffuse type is anti-SCL70 antibodies that you do. Now, moving on to the hand X-ray, like in my previous video, if you haven't watched that, please go and watch. So now in this X-ray, you can see, first of all, if you look at the soft tissue, here at the distal end of the fingers, you can see there is a bit thinning of the subcutaneous tissue. Though it is thickened from the outside, but there is tapering of the fingers, you can see. And then these clear, the most hallmark of systemic sclerosis is this calcification. You can see these calcinosis everywhere. It will be more common on on these areas. You can see these are more common in this metacarpophalangeal joint. You can see them on the elbows. You can see them on proximal uh, interphalangeal joint. You can see it anywhere in X-ray. Clinical, you can also feel for it in the pulp of the fingers and the elbows. So this is an X-ray of a systemic sclerosis. Plus, you can see other things also. You need to look for findings of rheumatoid, for any osteopenia, for any erosions, uh, so that you should be able to identify any other disorder in the patient. Thank you for watching this video. I hope you have liked it, and please like and subscribe. Thank you.